Bladder Buzz Week 7, Bladder Buzz Jeopardy and Sumo Fun Buttons. This week features the second educational in-service for the staff. This in-service includes the Bladder Buzz Jeopardy game. For the game, the staff should be put into teams, and perhaps the winning team shall receive a small prize. Hopefully, by the end of the 7-week program, staff members are comfortable with the types of urinary incontinence and treatment and intervention strategies for individuals with urinary incontinence. The Bladder Buzz team wants staff to feel empowered to make a difference in the management and treatment of urinary incontinence in residents with whom they work. Welcome to the final week of the Bladder Buzz. This week we'll be participating in the Bladder Buzz Jeopardy. This game reviews the different types of urinary incontinence and treatment and management skills in urinary incontinence. Form teams by breaking into groups of 3 or 4. I will need one volunteer to help keep score. If you know the answer, then raise your hand. I will call on the first person who raises their hand. The entire question must be read before a team can raise their hands to answer. A maximum of 15 seconds is set aside to answer the question. If a question is not answered or is answered incorrectly, then another team will have the opportunity to steal the question. Learning Objectives Week 7. The staff will be able to identify and differentiate between the types of urinary incontinence: stress incontinence, urge incontinence, mixed incontinence, overflow incontinence, and functional incontinence. Staff will be able to identify and differentiate between the types of treatments and interventions for urinary incontinence: prompted voiding, bladder rehabilitation, bladder retraining, habit retraining, and scheduled voiding. Suggestions for use. Put the staff in small groups for Bladder Jeopardy. Create a certificate showing the completion of the Bladder Buzz program. Offer a small prize for the winner of the Bladder Buzz Jeopardy. Distribute Sumo Fun Buttons to all staff who participate and complete the Bladder Buzz training program.